Today we're going to be looking at patient assessment, some components of patient assessment, biographical data, chief complaint, medical and family history, psychosocial history, activities of daily living, and advanced directives, which we've looked at when we were looking at charting as well. Biographical data, simply the name, date of birth, address, phone number, employer, age, marital status, religion, nationality, and status of advanced directives. Chief complaint. Attempt to identify the patient's chief complaint. Document this information in the chart by using the patient's own exact words. Do not fabricate or make up facts. Ask the patient what led to them seeking medical attention today. Ask the patient how and if the chief complaint has affected their life recently or if this is something that has been going on for a long period of time. I want you guys to memorize the acronym Chief Complaint, PQRST, to assess your patient. P, precipitating or palliative. What precipitates the symptoms? Does anything make the symptoms worse? Stress, anger, anxiety? What makes the symptoms lessen or go away? Laying down, taking Tylenol, taking aspirin or nitro, or simply stopping all physical activity? Q, quality or quantity? What does the symptom feel like or sound like? Are you having the symptoms right now? If so, is it better or worse than you've experienced? To what degree does the symptom affect your life? R, radiation or region. Where in the body does the symptoms occur? Does it radiate? Does it move between regions? Or does it stay still? S, severity. How severe are the symptoms? You will use the pain scale. On a scale from 0 to 10, rate your pain. 10 being the worst, 0 being the least. Are the symptoms diminishing, intensifying, or staying the same, depending on what you are doing? T, timing or temporal, sequence. When did the symptoms begin? Was the onset sudden or gradual? How often does the symptoms occur? How long do the symptoms last once they begin? U, understanding. What do you think caused the symptoms? How do you feel about the symptoms? Are there fears with it? Are you afraid you're having an active heart attack or it's something more? What are your expectations of the healthcare team? How do you want them to help you? Medical history, some questions that the hospital will ask during their admission. Have you ever been hospitalized? If so, what for? Do you have any childhood illnesses? Do you take any medications? If so, create a list. Have you ever had surgery? Do you have any allergies? These could be medications, the environment, or food allergies. Do you take vitamins, homeopathic remedies, or any other non-prescription over-the-counter medications, as these could affect the patient's blood work? Do you visit a chiropractor or acupuncturist? The reason the healthcare provider is asking these questions is because sometimes you can have a pinched nerve, or the way that the chiropractor moves you, you might have muscle pain or muscle spasms. So they're just trying to collect your history to get the full picture so that they can help you and treat you appropriately. Next, they're going to get a family history. Is your mother, father, siblings still living? If not, what were the causes of their death and how old were they when they died? Heart disease can run in the family, diabetes can run in the family. They just want to know what kind of history you have. If your parents are alive, do they have any of the following? Diabetes, heart disease, high blood pressure, valve problems, peripheral vascular disease, kidney disease, asthma, cancer, glaucoma, or blood disorders? There is often a checklist to complete at the physician's practice. This will give them a better idea of what your prior family history is. I think this slide is a very important slide as we all deal with stressful events in our life, especially with the economy and how bad it is in the world right now. Psychosocial history. Have you had to cope with any physical or emotional crisis currently or in the past? Has your life changed recently? If so, in what way? We all know how stress can affect us. Do you feel as though you have a good support system at home or at your workplace? Or do you feel like you're alone a lot and don't really have anyone to talk to? Do you eat regular meals? Do you use tobacco? Do you drink alcohol? If so, how often and how much? All of these can affect how you take care of yourself and increase or decrease your health condition. Support. How adequate or how would you describe the emotional support you receive from your family and friends? Does your family and friends tell you what to do, or do they listen to you and your ideas? How close do you live to a healthcare facility? Are there any financial concerns? Do you have health insurance? Do you feel safe at home? Activities of daily living, diet and elimination, exercise, getting enough sleep, working, leisure fun, tobacco, alcohol, and other drugs. We know at an early age that balancing sleep, work, leisure fun, dieting, it can be very stressful, and it's all about balance. This next slide is very important and one that you'll probably want to highlight. CVT pain assessment, cardiovascular technician, use old cart, acronym, O, onset. When did the chest pain start and are you having it now? Is it with or without physical activity? L for location. What is the location and does it radiate? Is it substernal, arm, neck? Where exactly is it? D for duration. When did it start? How long once it starts does it last? Does it come and go? Or is it a constant pain that you feel? C, characteristics. Course. Is the pain dull? Is it aching? Is it more of a soreness? Is it a stabbing feeling? A, associated aggravating symptoms. Shortness of breath or SOB, diaphoresis or being very sweaty, dizziness hurts when you move. R for relieving factors. What helps resolve or alleviate the symptoms? Simply resting, taking a few deep breaths, some oxygen, a few nitroglycerin tablets, changing your position from lying down to sitting up, or simply morphine to numb the pain. T for treatments, medications, non-interventional, heat or cold. If you pull a muscle or you have a strained muscle, sometimes heat or ice can help. Lastly, with patient assessment is to perform a physical exam. First thing you want to check is the general appearance of your patient. Does the patient seem with it? Does the patient seem like they're in any pain? Always check their eyes, ears, throat, and nose. Check their heart to make sure that they're not having any heart palpitations. Check their lungs to make sure that they're breathing okay. Their abdomen to make sure that there is no tenderness or soreness. Musculoskeletal, Neurological, make sure that they know where they're at and that they're able to squeeze your hand and move their feet properly to show that there's no neurological damage.